So I always knew that there was a possibility that I would take care of somebody that I knew or a coworker's loved one. I remember going into work one day and I started getting a report, and I was told that it was one of the nurses on the ICU's father-in-law. In the ICU, most people are intubated, not able to talk to me. So whenever I do get a patient that is able to talk to me and I kind of get to know them as a person, it's different. So going into the room and talking to him, I got to know him as a person. I knew his personality. He really wanted to get out of bed to sit at the chair and look out the window. So I told him let's see how the day goes. Let me see how you do. We were able to do that day. Get him into the chair. He had the biggest smile on his face. And then the following day, he wasn't doing much better. He was definitely more short of breath. I was more concerned about his numbers that day. And I was telling him we can't do what we did yesterday and get you out of bed to the chair. We gotta really focus on your breathing. We gotta lay on your belly. And I can still picture him looking at me. From outside, I was outside of the room, and I would see him give me a big thumbs up and a smile on his face. He just was such a loving, kind person that I got to know. And to go in a few shifts later to see him intubated and on his belly was sad. Just because I had hoped that he would be a little different. And even at that point, I hoped that he wasn't going to be like our typical patients that we saw that had the same hospitalization. But unfortunately, he wasn't able to make it, but he did put up a good fight. And that's just what makes it even harder, is that to know someone at that point where they were awake, talking, joking around on their phone, to now, intubated, unable to express themselves like they were before. It's just sad. And, I think that's what hurts the most. So I think that's why his situation affected me more, because I got to know him as a person. And he was an awesome person.